Knock, knock, wash my hands. Hello, my name is Stephanie. I'm going to be your nurse today. Today we're going to be doing a head-to-toe assessment. It should take about 10 to 15 minutes. I would now observe the environment, check that it's safe, check if there's any IVs, tubings, or any dressings, which I don't see any present. There was no odor in the room. I would check the client's position in the bed and make sure I maintain eye contact. May I please have your name and date of birth?
Pablo Pacheco, January 3rd, 2002.
Do you know what today is?
January 27th, Friday.
Do you know where you're at?
The hospital.
And do you know why you're here?
Head-to-toe assessment.
Okay. Patient is alert and oriented ×4. Speech is clear and coherent. Facial expressions are appropriate to the situation. Are you feeling any pain on a scale from 0 to 10? 0 being no pain at all and 10 being the worst pain ever.
0 pain.
Patient has no pain. So now I am just going to observe your face. Nose is midline. And now I am going to inspect their head and check their hair. I'm going to check for any wounds, lesions, and infestations. Hair is thick and black and is distributed all over the hair. And head appears to be symmetrical. I am now going to use my pen light and I'm going to check your eyes. Alright, just look right there with me. Right here. Eyes are reactive to light. Sclera is white. Can you go like this for me? Conjunctiva is pink. There's no sign of any discharge. Okay, you're good. Of any discharge or redness. Now I'm going to have you look at my pen light and just follow it. Alrighty, accommodation is good and eye muscles are good. Now I am going to check the ears, check for any discharge or redness or any lesions. There are none present. You check this one, and there appears to be nothing, so it's normal, and ears are symmetrical. Now I'm going to check patient's nose. There seems to be no signs of a deviated septum. I'm going to check for any discharge or redness. There's none. And now I am going to check your patency. Can you occlude one of your nostrils like this and breathe? And now I'll have you do the same with the other. Patency is good. Now I'm going to have you smile for me. And can you frown for me? Okay, facial is symmetrical. Now can I see your teeth? Are these your teeth? Patient doesn't use any dentures. Can I see your gums? Gums are pink and moist, and lips also appear moist. Can you stick your tongue out for me? Open up. Can you open your mouth for me? Okay, pharynx and tonsils are intact. Tongue shows no lesions. And now I am going to inspect your neck. There seems to be no signs of JVD, any masses, and now I'm going to just palpate your lymph nodes. All right, that's good. And now I'm going to auscultate and hear for any bruise with the bell side. And that's good. Alrighty. And for the assessment of the nose, I would also give them a cup of coffee and they would tell me if they smell it, and they would respond whether if they do or not. And this patient smells properly. Do you wear any glasses? Okay. Are you colorblind?
No.
Okay. Now I am going to inspect your skin. There are no lesions, no redness, no rashes. Skin is appropriate to ethnic background. It's nice and warm. It's not dry. I'm going to assess capillary refill. Capillary refill is less than 2 seconds. Alrighty, while I'm here, I'm going to test your strength. Can you squeeze these 2 fingers with your hands? So we're going to do it like this. Can you do that to me? Alrighty, good. I'm going to check range of motion. Okay, good. This one. Good. Alrighty, now I'm going to check your strength. I'm going to push back and you use strength, and now push back to me. Okay, good. Muscle strength is 5 plus. Now I'm going to check your radial pulse. And that's 2 plus bilaterally. Now I'm going to have you breathe in and out for me. And from the looks of it, patient is not using any extra effort of the accessory muscles. So just sit up straight for me, breathe in and out. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now I'm going to have you turn it this way. Doing a little bit. Alrighty. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Lung sounds were clear bilaterally. As patient was breathing, thoracic was even. Now I am going to listen to your heart sounds. Sit up straight for me, please. Okay. Aortic, pulmonic, herbs, tricuspid, mitral, and then I would check the apical pulse, and then I would listen to that for about a minute and get the patient's rate. Okay, so now I am going to assess their lower extremity strength. And then right there. Well, we're gonna do range of motion first. Alrighty. Alrighty, I'm gonna have you probably lay down that way for me. Alrighty, I am going to assess their abdomen. I am first going to inspect it. There seems to be no signs of any distension, no lesions, and now I am going to auscultate for bowel sounds and check if they're present, starting with the right lower quadrant. Bowel sounds are present. Now I'm going to palpate. Let me know if you feel any pain. Any pain?
No.
No pain. And now I am going to assess patient's pedis pulses. And check right here. We can do it bilaterally. Right here. 2+. And I'm going to check capillary refill. Capillary refill is less than 2 seconds. And you can sit up for me. I would also be doing having them with their feet do that, so to avoid and assess for foot drop. I'm also going to assess for skin turgor. There seems to be no skin turgor, tenting, or anything, so that's normal. When was your last bowel movement?
This morning.
Would you say it was normal or loose?
Normal.
When did you last urinate?
Like 10 minutes ago.
Okay, and was there any burning, any bleeding?
No.
Okay, then after that, I would be washing my hands. Thank you, and I will leave. And that's it. Thank you.